Cases of an illness that can be very serious, especially for babies, are on the rise. We're talking about pertussis, more commonly known as whooping cough. Now, these cases are very low in Colorado over the last 2 years because of all the COVID protections and restrictions in place. Now this year, those cases are going up again. So far, there have been 29 statewide, and compare that to just 7 cases during the same time last year. And let's also dig a little deeper and take a closer look at the rise in respiratory illnesses in general right now and how you can keep your family safe. News 5's Maggie Bryan spoke with multiple pediatricians in our area. So Maggie, what other illnesses are doctors also seeing right now?
Yeah, good morning, Ira. Doctors are definitely looking out for pertussis, or the whooping cough, because it does affect or can affect children and babies more extremely. But I talked with a doctor here at the Children's Hospital in Colorado Springs who says they're seeing a rise in RSV, which is a common virus with cold-like symptoms. That doctor told me that RSV normally affects children younger than 2 years old. And this year, he says those children haven't been exposed to the virus as much recently because of all the COVID precautions we've taken in the past 2 years. He says for the most part, children do well with RSV and it can pass like a common cold, but parents should know the signs of when to see a doctor.
Any sort of noisy breathing and difficulty breathing, they need to be seen by one of their healthcare providers, whether it's a primary care doctor, an urgent care after hours, or if they're really concerned that they are struggling to breathe, the emergency department is a totally appropriate place to.
And just like rising cases of RSV, we mentioned pertussis is expected to follow suit as a respiratory illness, but vaccines can help. So if you have a child, this is some important information you might want to listen to. The CDC says children should get 5 doses of the pertussis vaccine called DTaP before their 7th birthday. The first dose is at 2 months, then 2 more doses are given at 4 and 6 months to build up protection. After that, just a booster is needed from 15 to 18 months, and again between 4 and 6 years old. For pregnant women, the CDC also recommends getting the vaccine during each pregnancy, ideally during the 3rd trimester. That can transfer more protection to your baby while in the womb. And adults who have not gotten the pertussis vaccine as an adolescent or adult are urged by the CDC to get one every 10 years. And the physicians I spoke with said that adults should be getting this vaccine because they can be a carrier to pertussis, and although it might not give them those extreme symptoms, they can pass it on to those younger children who can deal with it a little bit more extremely. In Colorado Springs, I'm Maggie Bryan, News 5.
All right, thank you, Maggie. We just want to remind you of the beginning stages or symptoms of whooping cough. At first, it might just seem like, again, just a minor cold or even a minor case of COVID, runny nose, cough, and fever. But as time goes on, it's the cough that will intensify and get much worse. After about 2 weeks, you could develop a rapid or uncontrolled cough, and that's definitely when you want to see your doctor. That cough can last up to 6 weeks.